All right, so Connie and I are going to talk about scales. And what do you tell your patients about how often they should measure their weight?
I tell them it depends on what the number on that scale is going to do to them psychologically. For example, if they get on that scale at 8 o'clock in the morning, and if it's not what they want to see and it ruins their day, that's not a good thing to be doing every day.
Right. I utilize scales, but they could be our biggest enemy, like you're bringing out. And I think people get absolutely obsessed, and I've seen some really bad things with scales. First of all, I have seen extremely successful people that have done fantastic, that are running marathons,
Right.
that are living lives they never thought they could, but they feel like a failure because the number that they see on the scale is not what they said is their goal weight.
Exactly.
And so I don't use goal weights anymore with my patients. I don't say this is my goal for your weight. I tell people to set goals that they would never think they could do. Crossing your legs, running with your kids, running, I'm big on having people run races.
Right.
And I think if you do that, you don't really need the scale.
And I think people who are most psychologically well-balanced don't use the scale because they base their weight on how they're feeling, how their clothes fit, and if they're healthy.
Yeah, and I have got one patient who's actually going to be on our coming up episode of Big Medicine who is so obsessed with the scale that she's actually become somewhat anorexic because of it. So she's gone the other end. She's so obsessed with what that number says, as if that number defines her, which it absolutely does not.
It does not, and that's that balance thing, going from one end of the spectrum to the other end of the spectrum, but the focus is still on weight, the focus is still on food, and it's the same obsessive issue.
It's true. Now, I don't think weighing is necessarily a bad thing when you use it as a component to just kind of keep track. Like I like my patients to journal what they're eating and journal their calories, and then I tell people, weigh yourself once a week, the exact same time, on the same scale, wearing the same amount of clothes.
Right.
So that you get a pretty accurate, because if you measure different times, the weight is so inaccurate, you can measure two different times of the day and it's completely different. And that way, what they can see, and I think it's important for their mind to get this connection, that as their calorie intake increases, they may see a little bit of weight increase. And weight can be a tip-off that, oh, wait a second, I need to get back to my basics. And so it can be a reminder in that way.
Right.
But I think you need to set that, I think, once a week or maybe once every 2 weeks, because not a lot changes in a week. To change your weight, you really need to wait about 2 weeks. I think maybe once every 2 weeks in journaling it down can help you, make sure that you don't do the opposite of what we're talking about. Instead of obsessing, forget that you even need to keep track.
And basically, again, it depends on if that number's defining your worth as a human being, it's not a good thing.
So there's some people that you would say, when you meet with them, that they're so attached to that scale they should just throw it out altogether?
Yes, I think that's true for some people.
Okay. Yeah, I think everything's, what works for one person may not work for another. And,
absolutely.
I've tried to do a little bit hybrid, not throwing it out, but not making it a big part of goals and things like that. I think the problem is they come in setting a goal for weight, and I think that's the problem with the scale.
Right.
I think the scale's not evil, it's that goal weight.
Right, that becomes life.
Right, is that thing. And the other thing people don't realize is, I got my patients exercising heavily. You build muscle. Muscle weighs more than fat. You could drop fat pounds, be a lot healthier, fit better in your clothes, and yet that scale says the same thing, and you feel like a failure. And so, I really think, and a lot of our patients, their whole life has been dominated by that scale since they were kids. The scale's been telling them they're a failure. So I kind of like taking those things out and starting new approaches such as goal setting.
A lot of education, a lot of different ways of thinking.
Yeah.